Bonjour voisins et voisines, je m'appelle Kwame Yanka, je suis africain du Ghana et bienvenue à ma chaîne. Aujourd'hui, j'ai l'information très importante de mon pays pour vous. D'abord, le Covid-19 continue à frapper les pays occidentaux comme l'Allemagne, les États-Unis, la France, le Royaume-Uni et les autres. Et la situation en Afrique? La vie au Ghana est un peu normale, mais c'est obligatoire pour observer les protocoles sanitaires. Le Ghana est un pays d'Afrique de l'Ouest. L'année passée, le pays a imposé un confinement sur quelques villes, notamment Accra, Tema, Kaswa et Kumasi du 30 mars jusqu'à 15 avril. La raison est très simple. L'autorité a cru que la décision va contrôler la circulation du virus. Comme plein de pays en Afrique, le Ghana a survécu. Par instance, les étudiants en école primaire rentrent à l'école 7 mois après 9 mois depuis le début de l'épidémie en 2020. Ghana aussi insiste sur le COVID-19 negative test à l'aéroport avant d'entrer le pays. Dans le discours du président Nana AKUFO-ADDO à dimanche 3 janvier 2021, met la cas positive de COVID-19 au Ghana à 879. Malheureusement, 337 personnes sont mortes de COVID-19. Les plages, les scènes, les boîtes de nuit et autres places restent fermées. Oui, les citoyens continuent à observer les protocoles sanitaires. On écoute le président du Ghana, Nana AKUFO-ADDO.
As of 1st January 2021, a total of 712 positive cases out of 118,278 tests conducted have been recorded among international arrivals at the Kotoka International Airport. Indeed, the month of December alone recorded 387 cases. The positivity rate among international arrivals rose from 0.26% in September to 0.93% in December. These developments call for strengthening of the existing protocols to prevent the spread of the disease in Ghana in light of the new variant of the virus. Therefore, the following measures will be implemented in addition to existing guidelines on international travel for COVID-19 in Ghana. 1. All arriving passengers who test positive COVID-19, asymptomatic or not, will undergo mandatory isolation and treatment at a designated health facility or isolation center. The isolation will be for a period of 7 days at the cost of government. However, the final discharge of cases will be based on existing case management guidelines and protocols. 2. All passengers who are in isolation will undergo a repeat COVID-19 test within 24 hours of arrival, with the cost also borne by government. This test will also include genomic sequencing for COVID-19. And 3. All passengers who test negative for COVID-19 will be required to adhere continuously to COVID-19 safety protocols and will receive regular information on COVID-19 within 5 days of arrival in Ghana. Fellow Ghanaians, in update number 20, prior to the Christmas festivities, I made a passionate appeal to you to ensure compliance with the COVID protocols and reiterated that, amongst others, beaches, pubs, cinemas and nightclubs were to be closed until further notice. The task force that advises me on COVID-19 measures is constantly reviewing the situation and will propose to me when it is safe to lift the restriction. You will recall that in our quest to help shield you from the effects of the virus, government took the decision to provide relief to Ghanaians, which included the absorption of electricity and water bills. This relief package ended in December. However, with the continuing difficulties occasioned by the pandemic, I want to state the government intends to continue to support the most vulnerable in our society. Government will thus continue to pay the electricity bills for our nation's 1 million active lifeline customers for the next 3 months, i.e. January, February, and March. Additionally, all 1,500,000 customers of the Ghana Water Company, whose consumption is not more than 5 cubic meters a month, will not pay any bill for the next 3 months, i.e. for the months of January, February, and March. This relief package will be reviewed at the end of March. Our children must go to school, albeit safely. We are satisfied that in the current circumstances, the reopening of our schools is safe. So from 15th January, our children in kindergarten, primary, and junior high, in both private and public schools, will be back in school. All SHS-1 students will start classes from 10th March, with all his students embarking on a single-track academic calendar. Their seniors in SHS-2 and SHS-3 will, however, return to school from 18th January. I must stress that SHS-3 students in all schools, like SHS-1 students, will no longer run the double-track system. The expansion of infrastructure at the various senior high schools over the last 3 years has brought us to this favorable situation. However, the double-track system will still be applicable to SHS-2 students in schools that are employing it. Students in universities and other tertiary institutions are to be in school from Saturday, 9th of January. Prior to their return to school, government through the Ministry of Education and the Ghana Education Service will ensure that all institutions, public and private, are fumigated and disinfected. Schools and institutions with their own hospitals and clinics will be equipped with the necessary personal protective equipment and have isolation centers to deal with any positive cases. All other schools and institutions without their own clinics and hospitals have been mapped to health facilities. There will be, for now, no mass gatherings and no sporting activities. However, religious activities for students at school under the new protocols will be permitted. Social distancing and the wearing of face masks must become the norm in our schools.
C'est vrai que le vaccin arrive, mais en Afrique, les sujets restent très compliqués pour quelques peuples. Parce que, vaccin ou sans vaccin, la vie va continuer. Pour moi, les pays africains avons lutté très dur contre le virus que autres pays occidentaux. Au revoir, mais n'oublie pas d'abonner à ma chaîne et cliquer sur la cloche. Merci.